Hi, welcome to Socialpost Health Channel's viewers. I am Dr. Chava Anjaneyulu, Senior ENT Surgeon. I am working with the Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having all diagnostic and treatment facilities to treat ear, nose, throat problems, either allergy, tinnitus, vertigo, voice problems, snoring problem, and adenotonsillar problem. We are having the especially laser treatment facilities. We are having different lasers which are helpful in treating the disease, curing the disease. Many patients will suffer with the bleeding from the nose. They will have either intermittently or continuously bleeding from the nose. Either it may be in one side or both sides. Many patients, their nasal bleed will come anteriorly. Rarely that may go into the throat, and when they spit, blood will come. It may occur in either children, young people and elder people. In children, mainly from the little's area. This is the anterior portion of the nasal septum where all the major blood vessels will anastomose. Whenever child will jump too much at force or pick the nose, or he goes into the dry, hot, dusty weather, that mucosa will become crusty, and most of the time children will pick that nose with the finger. Once that mucosa crust comes out, underlying blood vessels will expose and that will bleed. This is the commonest reason for the nose bleed. Second common is in elder people, those who suffers with the hypertension, along with if they have any other problems, they use blood thinners. Hypertension and blood thinners is the another common reason from the nasal bleed. In elder people, if they have the hypertension with blood thinners, most of the times it will not spontaneously, it will come continuously, because their blood vessels will lose the capability to contract themselves. With that, their tension will increase because of stress. That blood pressure will increase, that will cause the blood bleeding further, and blood thinners will prevent the coagulation of the bleeding point, so blood will continuously flow. Most of the times in children, no need to worry. Usually when the children will have frequent nasal bleed, we coagulate that area with the chemical cautery and the patients will get complete relief. If there is no relief, we do the laser or cautery coagulation of the bleeding point. In elder people, it is must we have to coagulate that bleeding point along with the stoppage of the anticoagulants and control of the BP. If need, we have to admit that patient for 2-3 days to reduce their pressure, anxiety in the home. So if we can control this BP and decrease the dose or stop these anticoagulants, most of the times this bleeding will stop. So if you have any recurrent nasal bleeds, contact Asian ENT Care Center. They will diagnose your problem accurately with the endoscopy where the bleeding is coming, and once a cauterization and along with the control of the predisposing factors, your problem gets solved. Further updates, subscribe Socialpost Health Channel YouTube.